If you have ever typed a symptom into an AI chatbot and followed what it told you, this video is going to matter to you. I asked Gemini Flash the exact same medical question on 3 separate days, and I got 3 meaningfully different answers. Not different wording. Different guidance. This is a test of how reliable AI medical advice actually is. Before we get into the results, let me explain why this kind of test is worth running. AI adoption is moving fast, and health is one of the top categories people search on AI chatbots. Studies show millions of people use AI tools as a first step before calling a doctor, or sometimes instead of calling a doctor altogether. The assumption most users bring to these tools is that an AI works like a medical database. You put a question in, you get a consistent answer out. That assumption is wrong, and understanding why it is wrong could change how you use these tools. Here is how I set up the test. I chose a symptom scenario that is genuinely ambiguous in real medicine. Recurring mild chest tightness in a 35-year-old with no known heart history. That kind of question has a real range of possible answers, from anxiety to acid reflux to something that needs urgent attention. I kept the phrasing identical each day, same account, same starting prompt, no conversation history carried over. Day 1. Gemini Flash responded with a calm, measured answer. It said the symptoms were likely related to stress or muscle tension, suggested tracking the episodes, recommended lifestyle adjustments like reducing caffeine, and mentioned seeing a doctor if symptoms persisted for more than 2 weeks. That is a reasonable response in isolation. If I had only run the test once, I might have felt reassured and moved on. The 2-week window felt specific, like the model had a confident basis for that number. I noted the answer and closed the tab. Day 2. I opened a fresh session, typed the same question word for word, and the response was noticeably different in tone and in recommendation. This time Gemini Flash opened by saying chest tightness should always be evaluated by a healthcare professional, called out cardiac causes more prominently, and recommended scheduling an appointment within a few days rather than waiting 2 weeks. That is a meaningful shift. On day 1 the model was reassuring and pointed toward self-monitoring. On day 2 the model was cautious and pointed toward professional evaluation. Both responses sound authoritative. A reader has no obvious reason to distrust either one. Day 3 was the most surprising. The response introduced a diagnostic angle that neither previous answer had mentioned at all. This time Gemini Flash brought up GERD, which is acid reflux disease, as a likely primary cause, explained the mechanism in detail, and suggested over-the-counter antacids as a first step before any doctor visit. The urgency framing was completely different from day 2. So in 72 hours, the same question produced: wait 2 weeks and monitor yourself, see a doctor within a few days, and try antacids first. Those are not the same advice. In a real health situation, acting on any one of them could delay or redirect care in ways that matter. Now let us talk about why this happens, because it is not a bug in Gemini Flash specifically. It is a fundamental property of how large language models generate text. These models do not retrieve a fixed answer from a database. They predict the next most likely word, then the next, and so on, using a process that involves a setting called temperature. Temperature controls how much randomness is injected into each word choice. A high temperature means the model explores more diverse word paths. A lower temperature keeps it closer to the statistically safest options. Most consumer AI products run at a temperature above 0, which means every generation is, by design, slightly different from the last one. Add to that the fact that these models are updated regularly. Safety filters get adjusted. Fine-tuning runs happen in the background. The model you talk to on Monday is not guaranteed to be the identical model you talk to on Thursday. There is no version number displayed to the average user. Medical regulators have started paying close attention to exactly this problem. The FDA in the United States has been developing frameworks for AI-based medical tools since 2021. The European Union AI Act classifies AI systems used in health contexts as high risk by default. The core concern in both cases is reproducibility. A medical recommendation that changes with every session is not a reliable medical recommendation. Independent researchers have published studies showing that AI chatbot responses to medical questions vary significantly across sessions, across models, and even across geographic regions because the training data itself reflects different regional medical norms. What counts as standard advice in one country may not match the guidance in another. The frustrating part is that none of the 3 responses I got were obviously wrong. They were all plausible. They all sounded like something a competent person might say. That is what makes inconsistent AI medical advice more dangerous than obviously bad advice. Bad advice is easy to reject. Plausible but inconsistent advice is hard to evaluate without a reference point. So what do you actually do with this information? Here is a practical framework. Use AI for health literacy, not health decisions. AI is genuinely useful for understanding what a medical term means, learning how a condition generally works, or preparing questions to ask a real doctor. It is not reliable as a substitute for a clinical assessment. Second, if you do use AI for a health question, run the same question at least 2 or 3 times across separate sessions. If the answers are consistent, that is a weak signal of reliability. If they diverge significantly, treat all of them with skepticism and escalate to a professional. Third, pay attention to urgency framing. If one session tells you to wait 2 weeks and another tells you to see a doctor soon, the cautious answer is the one to act on. In health decisions, the cost of unnecessary caution is usually lower than the cost of missing something serious. The broader point here is not that AI is bad or that Gemini Flash is a broken product. The point is that AI language models were not built to be consistent medical advisors. They were built to be useful, engaging, and generally helpful across a huge range of topics. Health happens to be one of those topics, but it requires a standard of consistency these tools do not currently meet. Every major AI company includes disclaimers that their tools are not a substitute for professional medical advice. Those disclaimers exist for a reason. This test is a concrete example of what that reason looks like in practice. If this video helped clarify something you were already wondering about AI medical advice, hit the like button. It genuinely helps this channel reach people who need to see this kind of honest testing. Subscribe if you want more grounded, test-based looks at AI tools. Next video we are running the same consistency test on ChatGPT and Claude using legal advice questions, and the results are just as worth seeing.